Hi, welcome back to my channel. I know it's been a minute. It actually hasn't. I've been posting so consistently. But anyway, hi, welcome back to my channel. My name is Tadasia Diann. For those of you who don't know me, I am a registered nurse and I have been a registered nurse for almost 4 years now. And I'm doing this video because I want to teach you what you need to know in nursing school. Like during that time when I was in nursing school, I really didn't have any guidance on what to study. So I would read chapters and try to read. I'm not even going to sit here and lie. I would read all of them. I'd be trying to skim and I didn't know where to look, what to look for. And I was just trying to cram everything in this little bit of time. So once I got towards the end of the semester and after I graduated and everything, things just started clicking. And I'm like, a lot of the things that they test for was ADPI. Now, for those of you who don't know what ADPI is, we're going to go through it. I'm going to put everything on a screen and we're going to go through what ADPI is so you can know what to look forward to in nursing school, so you can stop trying to read chapters and chapters and they don't even test on everything. I literally thought I was about to become a doctor because all the stuff that we had to study, patho, this, that, you had to know all of this. It was crazy, but I'm going to break it down to you. And I'm going to put up also, after we go through ADPI, we're going to do some practice questions because I want you to know and think about what you're about to get into. And for those of you who haven't started nursing school yet, at least you can watch this video and see what to look for. And maybe this may even help you with your entrance exam. So stay tuned and let's get ready. Take out a pen and a paper because this may help you, especially if you're in nurse school. I would take out a pen and paper, and I'm actually gonna use this as a free draft, and I'll put it up, the link above, so that you can have a copy of this, so that when you're studying, you can go through this and be like, okay, this is what I'm supposed to be studying from, and this is what I'm supposed to be focused on. So let me focus on that, so it'll help you with your studying techniques. So see you in the next scene. Hi guys. Hi. Okay, so you have reached the part that you've been waiting for. So I made a little presentation for you guys, and I'm actually going to make this available for free. If you want to get a copy, it's going to be on my website that's at the bottom. So that way you can have this and you can keep going over it. That way you can stay on track. Okay, so let's get into it. So I'm going to present this. Okay, so how to study for nursing school. Okay, so you want to start with ADPI, as I have mentioned. So what is ADPI? So it is simply an acronym for the nursing process. So in the nursing process, there are 5 stages. So this will help guide you in your critical thinking and help you to individualize your patient care. What does ADPI stand for? So ADPI stands for assessment, diagnosis, planning, implementation. I also like to say aka intervention, and evaluation, which is if you have met the goals that you set for this individual patient. So when they test on certain questions, and you'll see that at the end, this is what they basically look for, but more specific. Like they focus on assessment, diagnosis, which it all links together, because when you're assessing a patient, you're figuring out either objective, subjective, you're figuring out whether their vital signs are good, and basically like the signs and symptoms of each disease and what you would be looking for that specific disease. And we'll get into that. So your assessment, this is the first step. This is most critical, because when you are walking into a patient's room, you're assessing the patient and you're assessing the room. You're looking around, you're seeing if the patient is safe. You're being very aware, not hyper aware, but you're making sure you're aware and you want to see what's going on with the patient. This starts before you even touch a patient. Your assessment starts by you just simply looking at the patient. You see whether they're well groomed, how they're talking, their tone of voice, whether they're agitated, whether they're happy. Like, there's so much you can get from a patient by just looking. So your assessment, it can be objective or subjective. So objective, I like to think as it's measurable. This is data, like concrete data that you can get from this patient, like vital signs, intake and output, height and weight, lab values. Those are measurable. So that's something you can get. Subjective is what the patient tells you. So, i.e., their complaint, their chief complaint, what they came in for, history, medications, certain signs and symptoms that they may express to you rather than you getting an actual value. So remember that, because that does get asked. So make sure you know that and know the differences between objective and subjective. So that's your assessment. So then you got your diagnosis. So based off your assessment, what is the likely diagnosis? Not medical diagnosis. So when you get into nursing school, or if you're in nursing school, then you know that your diagnosis is going to be a nursing diagnosis. It's not going to be the medical diagnosis that we usually hear, like COPD. You're going to have specific nursing diagnosis. So an example of this would be something like shortness of breath related to asthma exacerbation. That'll be an example. So it will be more specific for the patient. So this helps you prioritize your plan of care as well. I know we're focused on, exams and what to study for, but this will help you with your care plans as well. So definitely I would write some of this down. Again, you can have a copy of it and mark it up however you like. So that's your diagnosis. So for example, like I said, shortness of breath related to asthma exacerbation. Then you have your nursing goals. So it's time to plan. So what goals should you have for your patients? What goals should your patients have? I mixed that up. I'm going to fix that. So you want to relieve their shortness of breath, but that is very general. Of course you want to do that. So specifically, what are you going to do? You want that patient to sustain oxygen, O2 saturation above 90%. So maybe they're sat at like 86, and you need to get them up. So you put them on a nasal cannula to help get their oxygen up there. So, and you want to lift the head of the bed, and we'll get into all of that once we get to the interventions. So your goal is to relieve them from the shortness of breath. And then, like I said, you want to be specific. So this person is going to sustain oxygen level above 90%. So as you can see, relieve shortness of breath and asthma is really non-specific, general. You're not going to really get away with that diagnosis, but sustain the oxygen level above 90%, more specific. So goals, again, need to be specific to each individual. Think what I can do, what you can do to help that patient. You want to think of short-term and long-term goals. So I'm hitting on both your exam questions and your care plan, because this is what you will be doing. You will be doing care plans. And this helps. It's more like you're basically writing down what you're going to do for that specific patient during that day. You're basically writing it down. So it helps organize your plan for the day, pretty much. Just to go back. So your short-term goal is a goal that you have for the patient, like during their hospital stay. A long-term will be, further than their hospital stay, like when they're out on their own and they leave the hospital. So that's the difference between short-term and long-term. Implementation, as I like to say, you're implementing something. You're doing something, aka I like to call it interventions. So this is also very critical too, because you need to know what you're going to do for your patient. So based off those goals, what are you going to do to get to those goals? So think, before I give a pharmacological agent, what are some non-pharmacological things that I can do for this patient? Example, again, like the shortness of breath with asthma exacerbation. You will give your nebs, like your albuterol, which is short acting, which helps open up the lungs. So you remember something you're going to learn in nursing school, you always give the short acting before the long acting. So you want to make sure that you open up those lungs. But you can, like, non-pharmacological things are, you can lift the head of the bed to 30 degrees, depending on the setting, whether they're vented or not, suction them, and make sure that airway is clear. Give oxygen. And this is a good one, actually, when you're doing priority questions. Like, you want to make sure, like, if they ask what's the first thing you want to do, and it depends on the scenario. That's the thing about nursing questions. It depends on the scenario. Like, depends on, the information that's given to you. So that will decide in what order you would do this in. So again, you'll give your albuterol to open up the lungs, and then you want to give, let me make this a little bigger so you can see me a little bit more. You want to give education to your patient, make sure that they have an asthma pump, and make sure they have the means to get their asthma pump, because maybe, they're in the hospital because they ran out of their asthma pump, their insurance lapsed, they weren't able to give the asthma pump, they didn't have money to pay for it. Like, those are like certain barriers that, you would, that some patients will have. That's just the reality of it, and that's going further into things, but it's nice to think about that stuff. And you continuously are monitoring this patient, like they're hooked up to either, cardiac monitor, they have their oxygen probe on to make sure you're tracking what's their saturation. So those are interventions. That's what you can do for the patient. And of course, you would have to, when it comes to giving medication, especially in nursing school with the questions, you want to make sure that when you're giving medication that it is ordered by the MD, because you can't give medication that is not ordered by the MD or NP, whoever the provider is, or PA. The provider has to give you that order. So you'll see in questions, it'll say, like, they try to trick you in nursing school. I remember with me, like, it'll say, like, give this medication, but it needs to say, like, per the doctor order. Like, you have to have a doctor order. You can't just give the medication without a doctor's order. Okay, let's see what's going on. All right. Evaluate. Okay, has your goals been met? So was your patient able to sustain a oxygen level above 90% without oxygen via nasal cannula? So that is like, you're seeing if your goal was met. Whatever goals you set, you want to make sure you did your intervention, and that when you evaluate, were your goals met. If they weren't, then you have to go back to reassessment. You have to repeat it all over again. So you have to reassess, maybe change the interventions, change things, maybe different medication. And it's like you're doing the nursing process all over again with your team. So that's the care plan, and that's really the testing parts that you really want to focus on. So it'll make more sense when we start doing the questions. And then I have some ways that you can take notes that will help you eliminate all the reading. You still have to read, of course, but you won't have to worry about reading and thinking you have to know every single thing in these textbooks, because that's not the case. So let's go on. All right, so now we have the practice questions. So I'm going to move my face down here, of course, again. So we have the practice questions. So the nurse is taking the health history of a patient being treated for emphysema and chronic bronchitis. After being told the patient has been smoking cigarettes for 30 years, the nurse expects to know which assessment finding. We have 1, increased enforced vital capacity. 2, a narrowed chest cavity. 3, clubbed fingers. 4, an increased risk of cardiac failure. Okay, so this is how I want you to look at questions, because already, like, if you kind of listen to what I said, and especially with the ad pie, and you know what comes first, then something should shoot at you. Like, which one of these is an assessment? Now, and again, remember, assessment can be objective or subjective. So it's something that's measurable that you can see, or it's something that the patient is telling you. So those can be assessments. So I'm going to give you time to pick which one you think it is, and you can read over it. So again, this person has chronic bronchitis, emphysema, and they've been smoking cigarettes for 30 years. And it tells you in the question which one is an assessment finding. So you already, when you're doing tests, I want you to practice elimination. That will save you. Like, practice elimination. So which ones is not an assessment finding? That should help you eliminate at least 2. We're looking for assessment, not diagnosis, not interventions, assessment. So that you should already have knocked out 1 and 4 automatically. 1 and 4, those are not assessments. So you want to knock those out. So then we have a narrow chest cavity for number 2, or 3 clubbed fingers. What are some things that you see in, like, chronic bronchitis, emphysema, COPD? And this is when some of the patho comes in a little bit too, because you have to know what are these things, what are they lacking oxygen, and what are some of the symptoms or signs and symptoms or the assessment that you would see for somebody that's lacking oxygen. If you guessed it, you're right. Clubbed fingers. So you would see clubbed fingers. So it's number 3. So that there goes again that assessment finding. So you have to know exactly what the assessment findings are. So those are big when it comes to exams. So when you got your diagnosis, make sure that you know the assessment and what to look out for. Okay, question number 2. The nurse is taking the health history of a 70-year-old patient being treated for a duodenal ulcer. After being told the patient is complaining of epigastric pain, the nurse expects to know which assessment finding. Again, another assessment question. So you got to know your assessment. So you got to know the signs and symptoms and what to look for in these diseases. So we have 1, melena. 2, nausea. 3, hernia. 4, hypothermia. So I'm going to give you a few moments, and I want you to really read the question if you have to read it over again, and think about the questions. Again, remember I said eliminate what's definitely not it. This will help you narrow it down. So just cross it out on your paper, your mind, whatever you got to do. Eliminates the ones that's not it. Okay, so the patient is complaining of epigastric pain. What assessment finding would you find for somebody that's being treated for a duodenal ulcer? So you may think, if you don't know the assessment findings of a duodenal ulcer, then it will be hard to really eliminate, and you'll be like all over the place. But when you think of the specific area in duodenal ulcer, you're going to think of possibly bleeding. And what's the closest to bleeding? Number 1, melena. So that is the answer, number 1, melena. Again, like I said, once you know once you know your signs and symptoms for these diseases, it'll be a lot easier. That's why I want you to focus when you're reading your textbook. Make sure you focus on those assessments, those assessment findings. Okay, another question. So, a nurse is providing discharge teaching for a patient with severe GERD, gastroesophageal reflux disease. Which of these statements by the patient indicates a need for more teaching? So here goes like those tricky questions, because you got to like really read it. So it's saying which of these statements by the patient indicates a need for more teaching. So you have to find out what is the patient saying that is wrong. So you're looking for the wrong answer. So when you're reading your questions, read them slowly, read them carefully. You're looking for the wrong answer. Which patient needs more education because they have the wrong answer, basically. So 1, I'm going to limit my meals to 2 to 3 per day to reduce acid secretion. 2, I'm going to make sure to remain upright after meals and elevate my head when I sleep. 3, I won't be drinking tea or coffee or eating chocolate anymore. 4, I start twice. I gotta delete that. I'm going to start trying to lose some weight. So out of these questions, which one is wrong? And you have to teach your patient. So I'll give you some time again so you can choose. Again, you're going to eliminate the right answers this time. So you got to remember that you're looking for the wrong answer. So you're going to eliminate the right answers. So what do you see in GERD? What happens in GERD? Think about that. Again, think about like how to treat GERD. What are some interventions that you're going to do, or what are some educational tips that you're going to give your patients? And then you're going to take those out and you're going to look for the wrong one. So I'm going to limit my meals to 2 to 3 per day to reduce acid secretion. You do not have to reduce your meals. You could be having like between 4 to 6 meals a day, small meals. I'm going to make sure to remain upright after meals and elevate my head when I sleep. That is correct. You want to do that. So we're not going to pick that because that's right. I won't be drinking tea or coffee or eating chocolate anymore. That is correct. That's good for someone who has GERD because it makes it worse. I'm going to start trying to lose some weight. Losing weight helps when you have GERD. So, therefore, we have 3 right answers and we have 1 that's no, you don't necessarily have to do. So that's the one. So you want to teach your patient that they can have 4 to 6 small meals per day instead of 2 to 3. So that's, again, your education, in your education part, and in GERD what your patient should be doing when they have that. Okay, we're coming up on our last question. The nurse in the emergency room is treating a patient suspected to have a peptic ulcer. On assessing lab results, the nurse finds that the patient's blood pressure is 95/60, pulse is 110 beats per minute, and the patient reports epigastric pain. What is the priority intervention? Okay, so what will you be doing first? So this patient has a low blood pressure and has a high heart rate. So they are tachycardia. So 1, start a large bore IV in the patient's arm. 2, ask the patient for a stool sample. 3, prepare to insert a NG tube. 4, administer intramuscular morphine sulfate as ordered. Okay, so you got to think about the priority intervention in this case. So think about what's happening to the patient's body. So their blood pressure is dropping and their body's compensating, their heart rate is going up, and they have a peptic ulcer. So remember what I said about ulcer when it comes to like bleeding. Nice little hint. So I'll give you another minute to pick which one, because I don't want to give you the answer, because I like you to think for yourself, because that makes it better. Okay, so what is the priority intervention? So when somebody's blood pressure is dropping and they're going into possibly shock, you're not about to ask them for a stool sample at that time. It's not happening. Could that help? Yeah, because maybe they could have some blood in their stool. But what is your priority intervention? Prepare to insert an NG tube? No. What are you doing that for? 4, administer intramuscular morphine sulfate as ordered. Okay, has the as ordered, which is good. But no, that's not a priority. Because if they're losing, think about it, if they're losing volume, their blood pressure is low, you're going to want to prepare to give them fluids. So think about it, their blood pressure is low, they're going to need some fluids. So you would start a large bore IV in the patient's arm. So prepare to give them fluids. That's what you want to think of, and you're going to start an IV. That way, that's already set up, so you can give your fluids right away, so they don't deteriorate. So that is the answer. Okay, I thought that was the last question. We got one more. I put 5 questions in here. Okay, so if you did not get anything right, do not be hard on yourself. Like, please do not be hard on yourself. I do not want you to go crazy because you got everything wrong, a couple wrong. If you got everything right, kudos to you. You're killing it. But don't be hard on yourself, because after this, I'm going to show you how you should take your notes, and it will help you in the long run to answer these questions, especially when it comes to your exams and the NCLEX. So the last question: a female patient with atrial fibrillation has the following lab results: hemoglobin of 11, a platelet count of 150,000, an INR of 2.5, and potassium of 2.7. Which result is critical and should be reported to the physician immediately? Okay, so this, you straight up, you just got to know your lab values. That's it. So there's no really, so you have to know your lab values. If you don't know your lab values, then it's going to be hard for you to answer this question. So that comes off of memory. You have to learn your lab values. So off rep, we know potassium is low, so it's number 4. Potassium is low. Potassium is usually 3.5 to 5.0. So you know that the potassium is low. And when it comes to potassium, you want to think cardiac, heart. So that's very important. All these other, like the INR, the platelet, the hemoglobin, these are normal values. So potassium is the most critical, and that one's not a normal value. So really watch, if you're like, when it comes to labs and stuff, like I used to watch Nurse Sarah, so I'm putting you on, watch Nurse Sarah on YouTube. She is really good. Like, my professors used to say, like, oh, don't watch her and this and that, like, you don't know where people getting their information from. Nurse Sarah, she, like, how the way she writes it on a board and really breaks it down. And there's another video I have to find, and when I find it, I'm gonna link it on YouTube, and she did a really good job at just like using little mnemonics and using little things to help you remember your values and what happens when it's too high or too low. I'm gonna try to find that. But yeah, this is straight just memory. Just memorize them values. That's it. Okay, so answer 3, 1, 1, 1, and 4. You could check it again. We already went through that. Okay, so here goes the good part. I'm trying to make me smaller so that way you can see. Okay, so when it comes to taking your notes based off the questions, you see what I'm talking about when it comes to knowing your assessment, knowing the diagnosis, and sometimes even knowing the causes of these diagnoses. But usually, sometimes they really give you the causes, but you just got to know the assessment findings, what you're looking for, and the interventions. Those are very important. And patient education too. You want to know what you should be telling your patient and what you shouldn't be, because they do ask you a lot of that on your exams as well as the NCLEX. So when taking your notes, an example would be, say the disease is COPD you're learning about. So that is airway obstruction in the lungs caused by inhalants, which could be smoking or it could be fumes. So assessment findings, so the diagnosis of COPD, you want to know a little bit of patho, but that's, airway obstruction in the lungs by inhalants. That's the patho. That's as far as it really should go with the patho. I know that we have like a patho book in nursing, and it has like literally like from molecules, and like it's just overwhelming. Like, you do not need to know that. Like, this is the basic patho you need to know. Okay, you got impaired gas exchange, which is a nursing diagnosis, ineffective airway clearance. So you know that the lungs are not able to work correctly, in simple terms, right? Don't go crazy, because that was me too, going crazy trying to know everything in the patho book. No, this is as far as it goes. So the goals for that patient, improved breathing by, then their interventions, lifting the head of the bed, a spirometer, and then you have your evaluation. Like, did your interventions work? Again, if not, then you go back to assessment. But as far as taking notes, this is what you want to focus on. Like in your textbook, and your textbook should be similar to what mine was. It has literally sections in the textbook where it says assessment, diagnosis, interventions. Like, when it's lists like that, I want you to list like the assessments, specifically the assessments, I want you to list it. The interventions, I want you to list it. So you're going to write in big COPD, the assessment findings that you find in COPD, the interventions that you do. Patient education, you should talk about like no more smoking and like things like that. Like, you want to focus on those. So what I went over, the assessment, diagnosis, the intervention, you want to like really focus on those, and those should be in your textbook already separated and highlighted. So I didn't realize when I was in nursing school and they had those sections broke up, I would just be reading everything, reading the patho part, reading that part, not realizing that I needed to like focus on like, the ad pi, because that's what they really were testing on, and they still test on, as you can see in the questions that I showed you. And if you do, you can reach out to me, because those questions are on Quizlet and they're really good. There's 75 questions, so there's more questions to that. But yeah, that is pretty much it. Like, that's really all you need to focus on when it comes to taking exams. And I really hope this has helped. I tried to make this short and to the point, so that way, you really like understand and know what you should focus on, what you should be putting in your notes and what you should be reading. And yeah, so if you grab a copy of this, I really want you to go to the end of this, and I want you, in this underline, comma, RN, I want you to write your name. I really like that's, soon as you download this, I want that to be the first thing that you do. Actually, don't even start at page 1. I want you to look at this and then write your name in here, RN. So that way you are already visualizing yourself getting to that finish line and passing nursing school and passing your boards. You are speaking it into existence. So very important. That is pretty much it. So again, I'm going to make this accessible on my site again. That way you can have a copy of this, and or you can just rewatch the video and write it down, whatever you like, but I'm going to make it available for you for free just because this is a quick put together thing. And I just want you to succeed. So I hope this has helped, and congratulations to the ones who are at the finish line in nursing school, and congratulations to the ones who have not even started yet, because you took this step even though you had your doubts and you were scared, but you're still doing it. So congratulations to you. Any point you are at your journey, at any point, just give yourself a pat on the back, because you're taking that first step, second step, third step, whatever it is, you're still doing it. So I wish you nothing but success. If you have any questions, comment down below. If there's something else I can answer for you or that you want to see, just let me know. Be sure to like and subscribe, and I will see you guys next time.